Now, the United Nations says the number of tuberculosis infections are drastically increased over the past year, and doctors know at least 4 million people with TB are not being treated at all. VOA's Carol Pearson reports.
A simple cough can spread a number of deadly diseases, including tuberculosis.
TB is the threat that can be spread by an aerosolized spread, by not a behavior that increases your risk, but by standing behind somebody in line who coughs and infects you with the mycobacterium. No high-risk behavior associated with it other than wrong place at the wrong time.
In a Skype interview, Dr. Eric Gooseby explained that TB kills about 5,000 people a day, yet it doesn't have to be so deadly.
We can diagnose it. We can treat it with effective antimycobacterial drugs and cure it in about 90% of cases with the current drugs that are available.
Yet tuberculosis is considered a disease of the past in many developed countries, and budgets to fight it have been slashed. TB has been vastly undercounted in countries like India, where it's prevalent. Elsewhere, health budgets and medical workers have focused on fighting Zika, Ebola, and other emerging diseases, while TB has been ignored. And that's what has Dr. Gooseby concerned.
Our political will has waned, and it has been deprioritized in ministries of health as the urgent emergent disease to respond to. And as a result, we see TB beginning to increase in the number of deaths it's causing. We are now at a death rate of 1.8 million a year, which puts TB as the #1 infectious disease killer on the planet.
TB thrives in crowded areas where people lack enough food and good sanitation, which makes them susceptible to disease. But as the world learned with Ebola, it's not just a disease of the poor. Travel took Ebola around the world. It can do the same with TB. That's why the United Nations is trying to refocus the world's attention on tuberculosis. If all countries, rich and poor, cooperate, TB infections can be stopped. The goal is to end the disease by 2030. Carol Pearson, VOA News, Washington.